Did it ever happen that the person that is in coma to make a treatment like myofascial release, like something like that, work on the fascia?
To bring him out of a coma?
I don't know.
I'm not sure.
Exactly that, but to work on the person that's just living like there.
The cool thing about working on someone's fascia is that like you can't work on them while they're asleep. So like when my kids were babies, I would work on Silas as he was going to sleep, and when he would fall asleep, the best work would happen when he would fall asleep. So he would be all congested and have all kind of issues going on, ear infections and stuff, and I would do cranial work with him, and he would go from like snot and sneezing and not being able to breathe to totally being able to rest for a little bit. So I've seen it like be effective for people when they're asleep, kids particularly, because they don't really know how to lay there and be still. And they don't have to be still, but it's better to kind of relax into it, you know? But like dealing with someone in a coma and stuff like that, I've never dealt with that just because of my setting. I bet there's some people out there that have messed around with that, but I just don't know. So, but someone who's in a coma, they're unconscious, and what we talk about the fascia being a place where there's you hold your consciousness throughout your whole body. So working on someone fascially when they're in a coma, to me, would make sense. Mm-hmm. But I haven't had the opportunity, or I don't know any information about it. So
can we put it in our medical directives that we want you to work on our fascia if we're in a coma?
I guess so. I like it. All right, any other questions? All right, so we're going to go into page 6, which is the anatomy trains portion. And Tom also calls it the myofascial meridians, not just the anatomy trains. We'll call them the anatomy lines or the fascial lines a lot, but the meridians, Western medicine doesn't think that the meridians have anything to do with anything, because they can't dissect them. And if they can't dissect them, then therefore it doesn't exist. Chakras, none of that exists in the Western medicine because of that. But as we look at anatomy trains and the way these lines play a role, they end up looking very similar to the meridians. So, for example, this line right here on the lateral line, that line right there of the meridian, if we look at where it runs, there's a meridian line that runs almost identical to it. I don't know the meridians, I haven't studied them, but I just know from reading this book that that's a line that are very, very similar to the meridians. Yes. Yep, thank you. So the lines of these fascial lines, they were, when I talk about his lines, back to the anatomy portion of it, he took cadavers in the lab that were fresh, so they weren't embalmed and had all the chemical treatment stuff, and all their fluids weren't removed, basically. And from studying those lines, or studying those cadavers without removing the fascia, he found that there was a consistent pattern of these lines. Who's that?
One of them.
You can let one in, but you can't let Dudley in. Dudley's not allowed. So the anatomy trains, from a standpoint of what Tom's trying to create, is as a map, and it's a longitudinal anatomy. It's a sketch of the long tensile straps. That's the word I like, straps and slings within the muscle as a whole. It's a systemic point of view offered as a supplement, and in some instances as an alternative to the standard analysis of muscular action. The standard analysis could be termed as the isolated muscle theory. I was taught isolated, reduced, one muscle at a time. So this is going to come out of like looking at one muscle at a time, but going into a bigger, broader picture. So the word myofascial connotes the bundled together, inseparable nature of muscle tissues. Oh my freaking God.
I shouldn't have brought them. Daddy, you go out there and be with your friend.
Take them home. Yeah, I'm done with them dogs. Between Caleb and the dogs, I can't take it. Sorry, my dogs are misbehaving like always. So, inseparable nature of muscle tissue, myo, and accompanying web of connective tissue, fascia. Okay, so the word meridian is usually used in the context of the energetic lines of transmission in the domain of acupuncture. And that's another reason why Western medicine doesn't like it, is because anything acupuncture says, they will go out of their way to disprove it. However, now in physical therapy, they're teaching PTs to become dry needlers. So they're teaching PTs to become a 2-day, like what someone would learn in acupuncture in a couple years, the PTs think they can learn it in 2 days and start putting needles in people. And now they're dry needlers. So as our profession has pooed on chiropractics for, this is a rant on the PT world, as we've pooed on chiropractors, we're now teaching adjustments in school. As we pooed on acupuncturists, we're now teaching dry needling. So it's kind of interesting, my profession, how we don't have an identity. So we try to latch on to whatever the newest, greatest fad is. So it's just my thoughts.
We don't have an identity.
We don't. We have a terrible...
You're having an identity crisis.
Yeah.
What do we do?
It's true. It's true. So the myofascial lines, the meridian lines, are not acupuncture meridians, but lines of pull based on standard Western anatomy. Lines which transmit strain and movement through the body's myofascia and around the skeleton. So they're very similar, but they're not to replace it. But what Tom was able to do is, like, say, he would pull on one muscle right here, and as he would pull on that muscle right here, he would see tissue getting pulled all the way around and all the way around. So he started seeing that, whoa, this is a lot more connected than what I was taught in school. Now, will you hand me that little, that thing? All right, so this is what we're going to talk about as we get into the next word. This is what we call a tensegrity unit, or a tensegrity model. And what this represents is an architectural term, okay? There's a guy named Buckminster Fuller, was an architect, and he created this idea of tensegrity. And if you look at certain architectural buildings or nice, cool bridges and cool structures, they'll have this kind of appearance to them. It might be a big long array of them, but what it is it's a unit. It's a structural unit. So I'm going to read the definition. Tensegrity was originally introduced by the architect genius Buckminster Fuller. Dean Johann noted that the vertical position of the skeleton is dependent on torsional, whatever word that means. Torsional, is what I'm going to think that should be. Forces generated by the fascia, the tone and contractility of the muscles, as well as the hydrostatic pressure of the fascial compartments. Bones are rigid beams. So we're going to say in this structure here, the wooden dowels are going to represent bones, okay? Bones are rigid beams whose positions are determined by the myofascial elements, or the guy wires of them. If you think of a tent or a structure that will have guy wires supporting it in place. All right. So the fascia, muscles, and bone create a tensegrity unit. The integrity of this unit is dependent on the tensional force of the guy wires. So what that all means is that we're all connected through this form of tensegrity. And bones being the wooden dowels, the black rubber bands we're going to represent as fascia. Again, I'm not going to use the word muscle, we're going to use the word fascia. So this little piece of fascia, or this line of fascia, could be any piece that I'm pointing at above me. But let's just say this one little line of fascia is a little tight. Now watch what happens when I twist my hand here. Every bone in the body is affected by one tight muscle. So when someone says, well, why is this one area that we're working on affect my foot? Well, there it is right there. And when I say it's all connected through this tensegrity unit, through this tensegrity model. So let's say, hand me the foam roller. I'm sorry, the pool noodle there. The blue pool. Yeah. It's in the. There it is.
This one?
Sorry, I wasn't very clear. Thank you. So let's just say this is a nerve. Okay, let's just say this is just sciatic nerve. Everybody's heard of the sciatic nerve before, right? And let's say this is a tight pectoral muscle in your chest. We're not even this would be the muscles really next to the sciatic nerve. Like everyone's going to say, oh, sciatic nerve, piriformis, glutes. So we're going to say this is your glutes and piriformis. But down here, this furthest away from it, we'll go all the way over here, the furthest away from it, we're going to say this is your jaw. And watch what happens to the sciatic nerve. It's getting compressed. Every freaking thing in the structure is getting changed by one little muscle. And again, as I'm talking about holism, I'm now talking about one little muscle. But one little muscle is a piece of that whole chain being imbalanced affects the whole, everything. So your sciatic nerve may be affected by your jaw. Wait, what? That's not right. Well, I've worked on people's jaw and seen their sciatic nerve go away. I've worked on people's pelvis and seen their headaches go away without touching the area that I should touch based on what should be done according to their problems. So that tensegrity unit, that one up there is also a tensegrity unit, that yellow one. That's a model from the 70s. I bought that from eBay. It was a 1970s or maybe even 60s toy. It's a model. This one they're making it for these purposes. And now you can actually buy a whole skeleton that's a tensegrity unit. Cool. But it's pretty pricey. It's pretty spendy. But it's pretty awesome. It's about $2,000 for it.
Nice. So
tensegrity, you'll hear that word. People talk about it. It's a phrase that it's more of like how you think about and explain this big picture. Okay, but you'll start seeing that tensegrity unit out in architectural structures. If you Google the word tensegrity, it's all going to be based around, initially everything you're going to find at first is going to be based around architecture, and then you'll start seeing the second page, and a little further down you're going to start seeing it into the bodywork and anatomy. All right, now the double bag effect, I'm not going to get too much into this. This is irrelevant for the big picture, but it's kind of a neat concept. And basically all the double bag means is that we're created from cells dividing over and over and over and over, okay? And so and I'm not going to get too much into this, but it is there, so I'm going to go over it a little bit. If you think of this pillowcase as being like a bag, right? There's a cylinder like this drawing right there, the first one, okay? Mm-hmm. If you think of that bag as the cylinder, or that's the bag, and I put my two hands in here and I do this, I've created this. Mm-hmm. Every structure in our body, organ, muscle, is coming from that double bag idea. I taught this the first time. I don't think it's that important, but from an embryological standpoint, it goes into great detail into it in the anatomy trains. I think it's important, big picture, but I don't think it's important for us to spend too much time in it. So, embryologically, the way we developed and the way the whole body ends up being connected starts from this idea of one cell dividing. So the way we go from one cell to two cells is, and then it forms together, and then that's a cell. And then it just continues to happen again. But it's not that important. I should just delete that part out. So, any questions about what we've talked about so far? All right. If you're interested in the double bag phenomenon, look more into the book. But I found that as I taught it, it just wasn't relevant for
which book?
The anatomy trains book.
Yeah.
Because now I'm pretty much just going through his book. It's like a summary of his book. So we talked about this a little bit: muscle balance and tone. Oh, I'm sorry, I've missed derailment. Whenever Tom discusses his wording, when you look at the tissue, this is really all one piece of tissue. From the femur, or from the pelvis, the AIIS, down to the foot. But then right here, from the pubic bone all the way up, those are really two different lines. So they're not truly connected. So from right here to right here, that's a derailment. Okay, he calls that a derailment in the idea of using the analogy of a train. So we can go from, this is a station to here, but then it goes from here to here. The rest of these lines are pretty much all connected. So when we look at this line, there's no derailment. And all that this means is that this is one continuous piece of tissue that he's dissected in the lab over and over and over. But there is nothing on anybody that connects this to this through his ideas. So
then if you're working on something in that superficial front line, let's say you're working on something up in the chest, this is a place where they're not going to feel it in the foot because it stops that connection.
According to these lines.
Okay.
Back to the three-dimensional spider web that everyone has.
Yeah.
I've had stuff on my head go to my foot. I've had stuff go all over. There's not always a rhyme or reason.
Okay.
So that yes and no.
Okay. Yeah.
But there's no continue.
Yeah.
We're not going to stretch something right here.
Yeah.
And see an improvement in your extension. Okay. Whereas in a moment we're going to stretch something in your foot and you're going to see an improvement in your hamstring.
Yeah. Yeah.
But like no, this is all connected. So there's a reason I spend a lot of time with someone who has an issue where their pelvis is getting pulled forward all the way down into their foot. Mm-hmm. But they're just not connected. So, but that's the only one that's way, I think it's that way. And then there's one other piece up here that it kind of starts and ends abruptly.
Okay.
And it doesn't kind of end in this like spot.
In this spiral pattern.
But as we look at this first line, one piece of tissue all the way up. So this is like two muscles, a right and a left back line. This, I would say, is three muscles.
Yeah.
One in the middle, two in the legs. Or slings, or lines. Muscles may not be the appropriate word. Oh, Cheryl's back.
It's hot. Hot?
Mm-mm. Okay. So we have it outside?
No,
You
but
turn the fan on?
Stuff in here, it's
You know what, it's cold out there.
Are they done? Are they done teaching?
No, she's still teaching.
Like 15 more minutes? We'll open that door as soon as they're done. Okay, so now we've talked about this already, the lock short and the lock long. But here it is defined. Lock short, a tense muscle that is held in a state shorter than normal to create a postural dysfunction. Example, pectoralis minor is tight, pulling the scapula forward, creating imbalance. I don't know, that's a misspelling there. Lock long, the muscle that is stretched and weak as a reaction of the lock short muscle. The rhomboids and lower traps and lats are locked long as a result of the pectoral minor being locked short. Okay, and we've talked about that a little bit already. That is again kind of my whole theory with treating all my patients. Now, lock long and short does kind of look at a little bit of like one specific area and muscle, but it's easy for patients to understand that terminology. So then we start talking about, well, that one muscle's locked short, but it's really all the way down to here. That's when they start realizing, oh, this is why you're working on my bicep to actually help my shoulder and neck position. Okay, so now we're going to get into the superficial back line. So the first one we're going to talk about is this. Now, actually, I'm going to hold off on this, and we're going to now go to the video because I'm going to do this outside, or at the end of the day we'll go through each line where I got a little more room and looking at the skeleton. So let's take a little break for just a second while I set up the video. It should take me like 2 minutes. Any questions? And what we're going to watch is a video that's going to show fascia live in the flesh. It's pretty cool.